Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers podcast. This is going to be fascinating. I'm really excited about this one. So, sitting here today with the wonderful Shanil Ebrahim. Shanil is a partner at Deloitte Canada. And Shanil reached out to me maybe a month or two ago, and we had the good chance to kind of connect on a call previous to this, and we quickly just spent like half hour, 45 minutes getting really deep into some really interesting things about the Canadian health system. And so on this podcast, it's obviously the central theme is value-based care. We talk about the U.S. health system, but it's so interesting to talk about a country that is right next door and a very, very different health system. And so we'll get into all that. But first of all, Shanil, thank you so much for joining today. I'm really excited about this.
Happy to be here, Mandela, and looking forward to it.
So let's get into some of the basics. If you can talk a little bit about the major differences between the U.S. and Canadian health system.
Yeah, absolutely. So I guess one of the main things from a Canadian healthcare system is that it's a universal, publicly funded system, whereas the U.S. is more of a private, two-tier type of systems as well. So as part of that, in a publicly funded system, there's universal coverage that's provided, and there are more grounds for implementing value-based care. Whereas in the U.S., there's much more financial incentives that's actually tied to value-based outcomes, where it can be actually much more complex within that culture. So that's just kind of in a nutshell, what are the key differences as well. I'm happy to kind of dive into it.
Yeah. And, it's funny. I can't be the only one that didn't realize this. And I actually lived in Toronto for like 15 years. So thank God I didn't have much interaction with the healthcare system there, which is a positive thing. But I did not actually realize that you cannot just move to Canada and open up shop. You can't just or live in Canada and just be a doctor and decide, you know what, I'm gonna charge $10,000 an hour. You just can't do that. You have to work under the government. And so talk about if you can just help clarify some of the details around that. And they're like contractors, they're not direct employees. What is the relationship between doctors and the government from an employment perspective?
Yeah, absolutely. So, it is fascinating, right? Because we're just north of the border of the U.S., so there's a lot of misconceptions in terms of what we can and what we can't do. But we typically compare ourselves to our European colleagues, specifically in the UK, which is where a lot of the elements of Medicare have actually come through. So, there's some basic principles of Canadian environment that I think are important. So I talked about universal coverage. So Canada has a publicly funded healthcare system, which is Medicare, provides that universal health coverage to all citizens and all permanent residents, which means any essential medical services, think of this like hospital services, are available to everyone, irrespective of your province or your employment status, or your income. And
what about
part of it?
What about citizenship status?
So in permanent residents do get it. If you do not have any sort of citizenship or permanent residence or even landed immigrant papers, then there's an ability to pay out of pocket. But even there's a significant amount of coverage in terms of how we protect the landed immigrants to actually come there as well. So there's a lot of protection just to ensure that we are taking care of everyone unless you're a visitor.
Gotcha. Sorry, and I cut you off.
No worries. So one of the things that you actually mentioned was how things are actually funded. So in healthcare in Canada, it's primarily funded and administered through government, whether it's through our provincial systems, like our provincial healthcare insurance plans. And each province technically operates its own healthcare system, but we follow our federal body or federal act, I should say, which is the Canada Health Act, which dictates exactly how money should actually be spent. And the way that our system is fully funded is through taxation, which covers most healthcare services, which are hospital care, physician services, and diagnostic procedures. Where it doesn't cover us is things like dental services or allied health professionals like your physiotherapists or your chiropractors of the world. And this whole single payer system also allows for significant cost control and negotiation power, as you can imagine, because now you can actually have private bodies actually charging an arm and leg for certain type of services, or it's luxury type of services as well. So that's like the good thing. The challenges though are around access and wait time. So anytime there's one body that's actually dictating everything, access to primary and emergency care, especially in Canada, faces a lot of different challenges. No one is denied care because of inability to pay, which is great, but your access to specialists or elective procedures or anything along those lines becomes a big challenge, where you contrast that with the US, it's a much more of a mixed system, right? So you have an ability to get, you have access to, the public care, but at the same time, if you want faster access, you can go through your private care as well. We don't have that same option.
Yeah. And let's talk about the negotiating power for a second, because, that sounds like a really great thing from a cost perspective. But it also affects the actual doctors, right? It also means that the government, I would imagine, gets to dictate what a doctor makes that works with the system, and there's nowhere else basically to go. And what I found really interesting is there seems to be, very strong cultural differences between the US and Europe when it comes to this kind of thing. So I think I talked to you about this last time, but I was in DC doing kind of like, man on the street style content, just talking to people that were there, tourists from different areas. And I spoke to this couple from the Netherlands, and they were talking about their health system, which is kind of similar to what you're describing, and they pay super high taxes and they're kind of fine with it. And when I asked them this question, I said, what is like a top specialist, like top doctor make? And their answer was like, maybe 250,000 euro or something like that. And I said, doesn't that bother you or don't you think that might bother some doctors that they can't make more money because there's no one to, they can't control what kind of income they make? And his answer to me was, well, that's a great living. Like, that's a great salary. What are you talking about? And there's a very, and obviously in the US, we're very capitalistic, and we feel like if I can make $100 billion, and that's what I should make. And in Europe, it was kind of like, well, it's a lot. It's the actual culture is very different. So, kind of a two-part question, but how does it affect the government's ability to kind of control costs? How does that affect doctor salaries? Is there a limit, and a pretty low limit that they'll hit? And then if so, how does that affect morale or doctors' interest in pursuing that career in Canada?
Yeah, a lot of great questions there, right? So I think, if we take a step back just in terms of how the negotiating power works in Canada, so because it's a single payer system, there's obviously going to be significant negotiating power over any sort of health costs, whether it's physicians or pharmaceutical prices or medical device costs and whatnot. So the benefits, of course, being able to bring costs down is going to be advantageous in terms of the public citizens who have to pay less taxes to be because we're actually feeding a finite budget. But it also allows for standardization, right? Because there's uniform fees. It allows for that establishment of uniform fees across all different provinces. So it ensures that any residents are actually receiving similar levels of care without significant cost disparities. That's huge. Also, quality is something that we're extremely proud of. You end up getting consistent quality because of the standardization of cost as well. And that, naturally lends itself to more equitable care that we provide to everyone. So those are, let's call it, the benefits. The challenges, you called out some of them. Some of them are, with any sort of limited budgets or any sort of prioritization, it has a huge impact on healthcare providers. So doctors and other healthcare providers, they're going to face, income constraints due to negotiated fee schedules, which may be very different in other countries. So Canada, because we're geographically located next to US, but at the same time, we're closer to Europe, it does present some challenges where we end up having two different mindsets. One mindset is more similar to our European colleagues, where we say, this is the society that we end up living in, and we are comfortable with the way that we end up having the principles on how we actually govern and standardize our cost, which is fantastic. However, when we see there are doctors actually flocking to the US because they want to be able to get paid more, and it's not that far away.
Right.
We end up actually losing a lot of doctors as well, which end up putting a huge burden on us because of compensation. No different than, if we're in one organization and we see another organization who's doing very similar things down the street, we end up thinking, well, if they're getting paid more for the exact same type of work, why wouldn't I go there, right? And that presents a huge challenge. And of course, we know that there's other country differences as well. But this is where, just an impact of, how I think about doctors. So we talked about kind of that income stability, I'll say. It's going to be more in US because they offer much more financial security. But in terms of things like work-life balance or challenges with compensation, this is where it may differ, right? Because one of the things that in Canada, it's much like our European colleagues appreciate quite a bit, is much more of a work-life balance that's afforded by the Canadian healthcare system. Because there's absence of this profit-driven environment, there's a much more balanced approach to practice, and which leads to much more higher job satisfaction. And a lot of people say, I could make more money, but I would have to kill myself to be able to make that money. And that's the balance that they're willing to work with. There's also different political climates, right? And that has actually increased quite a bit over the last few years. So this has led to less flocking to the US. And one of the things I think we've found, I'm going to call it a happy medium, kind of depends on which doctor you talk to. We end up paying our physicians much more money than our European colleagues, but less than US. So this is where we try to figure out what the right balance is, knowing the different pressures we're seeing across the different climates. But we're able to, we've been able to standardize our costs to be able to do that, which has led to less physician burnout as a result. So those are the kind of things that we have actually done to be able to kind of balance the two worlds and think about how we actually compensate doctors quite well.
Yeah. And kind of final question on the just the general structure. I mean, when you have a single payer system, that it sounds great with the assumption that single payer is, an efficient, wonderful, effective governing body. I'm not going to speak for Canada, although we get to see a lot of fun clips from the from what is it, the House of Parliament? What's it called over there in Ottawa? But, typically, at least in the US, and I think in general, these huge governments of massive countries don't exactly have a good track record or a good name for running things well. Typically, when the government gets involved, it just things are just not efficient. And so it could be that the government is not allocating those resources effectively or intelligently. And that obviously will have an effect on quality, which you mentioned earlier is actually, you seem to think is quite good. So what are your thoughts around the way the government actually handles the healthcare system? Has the government gotten too big? Has the healthcare system gotten too big? Or do you think they're doing a great job?
That's a
loaded question.
That's definitely a loaded question as well, just in terms of is the government actually doing well, right? So, and this is one where I could say truly it does depend. Because if you think about some of the advantages in terms of where the government is efficient, or I don't want to call it efficient, I'll call it strong. So one of the greatest strengths in the Canadian healthcare system is its ability to provide universal coverage, and we've done a great job in terms of that. So every citizen and every resident, they have access to the essential medical services that we've promised as a result of our Canada Health Act. And that's a huge accomplishment in terms of what we're trying to achieve. And I know in the US, Obama was trying to actually pass this, and there was quite a lot of pushback when it came to this, right? So when we look at a lot of privately run healthcare in across many countries, we can be proud to be able to say we've been able to achieve universal coverage. So that's one. Second is our cost compared to the quality and the outcomes that we receive. Because of the negotiating power that we have with government, we've been able to standardize that much better, and we've been able to keep costs relatively low. I would still think it's higher than what we would like when we compare it to countries like Switzerland or or Sweden, for example, but it is much lower than, a significant chunk of OECD countries as well. So that's, another one when we think about cost control. The other good thing that we've also done quite a bit is just in our ability to implement public health initiatives. A great example is, what's, happened in during the pandemic or any national vaccination program or any disease prevention efforts. Our ability to be able to do that and mobilize as a country is actually quite fast as well. So I think those are the kind of the good things that has happened as a result of, the government actually running healthcare. But as you can imagine, there is still significant challenges. And the first big one is bureaucracy and red tape. The biggest criticism that we have in Canada is that government is extremely slow and bureaucratic, leads to inefficiencies in our service delivery. So a lot of the things that we have been trying to refine over the years or have, clear big transformations or big health reforms, those processes can be quite lengthy. And there can be delays in implementation of the new policies or technologies. So when it comes to innovation and in terms of technology implementation, we're quite behind. I think, US is, much further ahead. We look to countries like Scandinavian countries or Israel, for example, who are so much further ahead with simple things like electronic medical records, which has been digitized all over the country. And anyone who kind of comes into our country and we're talking about, we're going to end up putting our health records into digital platforms, it seems very behind. And these are the kind of things, because of bureaucracy and red tape, that we're quite behind when it comes to other countries. So that's a huge challenge. And the second one is anytime you end up dealing with one entity kind of governing the envelope, it leads to challenges in resource allocation. And allocation has been such a big challenge that we have a massive shortage in human health resources, and that's led to even longer wait times and limited access to certain treatments and technologies. So even our essential services, yes, we have access, but how long does it take to actually get access is a major challenge as well. So those are kind of the big challenges that we have, and your question that you mentioned around, has the government gotten too big? It is a pretty nuanced question, and proponents of the current systems, argue that the government involvement is necessary to ensure equity and access because of the benefits of universal coverage, and it outweighs the drawbacks of bureaucracy and slower innovation. But any critics of the current system says we've been falling down the list of our OECD counterparts because we've gone too big. Now we suffer from so much inefficiency and excessive bureaucracy that we really need more private sector involvement. And if anything, we have seen certain shifts in regulation to allow certain private operators to work within the Canada Health Act. And that's a huge result of the inefficiencies that we see in government. So those are, some of the key things that kind of come to mind just in terms of how the government plays a role and where I see it.
Yeah. And so that actually segues really nicely into my next question, which is, if I remember just the feeling from our earlier conversation, and so this is kind of making an assumption here, but my understanding is that the feeling in Canada on all sides is that it's time for change, and that change is not just inevitable, but really, really critical and necessary, or else, large pieces are going to start kind of collapsing in the future. What is that state like? All the things that you described might be the underlying kind of behaviors and elements that are creating this condition. But what is that feeling right now on both sides of the political aisle, and just the general feeling in the country? And then we'll get to kind of your work at Deloitte.
Yeah, and it's a good question. So when you say, what's the feeling? Are you thinking about certain stakeholders over other ones?
I guess your feeling. I mean, what do you think? Where do you think the country is? Because a country can kind of do little dips and little ups and downs, but there's a certain point where it's like, okay, we got to change some fundamental things because of XYZ. Otherwise, we're going to start breaking.
Yeah, no, it's a great question. I would say across the board, there is a growing sentiment that our system does need to change and it needs to shift to value-based care. This is where we focus on improving patient outcomes and the overall experience rather than the volume of services provided, which is still the primary notion that we end up basically working with. And there's a lot of things that I feel that we need to change to actually shift towards a value-based care. There's one thing about saying that we focusing out on outcomes, but how do you actually do that? And how do you actually prioritize quality of care? And that means a fundamental shift in how we measure success in healthcare, which means thinking about our KPIs very differently and how we actually charge for it.
Yeah.
So that's definitely the biggest one. The second one, just in terms of value-based care, a lot of times we're in silos where we think about primary care and specialty care and the different services that we provide. But in reality, we know that healthcare is much more integrated, which means we need to develop those integrated care pathways that kind of ensures that seamless coordination among different healthcare providers and also lessens the burden on certain health services more than other. So this way, we don't need a flock of people going to emergency care because they can't get access to their primary care. If we're able to, it just kind of moving the problem to another area which is not equipped to be able to handle it. Same thing with being able to bring certain things to home is going to be very critical as well. And then another key part of the value-based care is around that patient-centered approach. We talk about patient-centered approach all the time. Like we're not patient-centered because we're still working towards our old healthcare models where we're talking about running a hospital much more efficiently, as opposed to implementing true patient-centered models that consider the individual's need and preferences of patients. And I'm a firm believer that if we focus on outcomes and we try to get people out of the system, which is including preventing the need of even healthcare, that ends up kind of shifting the dial, quite a bit. To really get this done, there's a couple of things that kind of come to mind. The first thing is the incentive structures has to change drastically. And this kind of comes back to that whole, like how we have traditionally done it in terms of a fee for service model to a payment model that rewards outcomes and efficiencies, such as, bundle payments or, capitation models, where we incentivize providers to focus on quality of care rather than quantity. That needs to change. Our performance metrics really needs to be evaluating the effectiveness of care. That's another big part. And I'm a fundamental believer that we don't need to go to a privatization in terms of financing, but we need to change the way that we work with the private sector, which means we need to encourage collaboration between public and private sectors to innovate and implement value-based care solutions, which includes private delivery where government is actually financing it. And the best example of this is we had a massive backlog of knee and hip surgeries over the course of the pandemic, and there was no way that we can actually bring that down. So what we did was the government actually decided, okay, we're actually going to fund private operators to come in, build private surgical facilities, and we're going to fund them. So it's still one negotiating power, but now you actually have much more resources at your disposal. And that's changed the way that we've actually brought down our backlog. And hospitals are now partnering with these private facilities to think around how do we actually think about pushing volume through our door much more and take a piece of that. That's changed drastically. If I had this conversation with you about a year and a half ago, I wouldn't be talking about that. And that's something we're doing at the forefront as well, which is actually quite exciting.
So what the status quo was that the government would build the facility, the government would do everything from A to Z, and the difference here is that you're allowing a private company to come and almost take on a government contract that's going to say, all right, we're going to pay you X amount. Now you go ahead and figure it out, and then the private company is able to use their resources and their infrastructure and build and adapt to that contract, right?
Yep, that's exactly it, right? And that's fundamentally different, and I love the way that we're thinking about it because we keep having the wrong conversation around private versus public, as opposed to public versus private and public. And we're not talking about private financing, which, by the way, has worked in a lot of European countries like Germany and Switzerland, where they have a dual system, but it's so well integrated. But it's around private delivery, which is changing the way that we think about things. And I know there's a lot of naysayers, a lot of the hospital CEOs that I ended up speaking to, a lot of them talk about private focus much more around throughput and just getting people out the door. But like contractually, you can end up changing that with focusing on outcomes. And so some of the more innovative hospital CEOs see that and they're able to govern that really well. And we're starting to see that movement. So that's actually quite exciting.
Yeah. I actually think you guys are at a certain huge advantage by being behind, because you're able to look at what everyone is doing right and wrong and hopefully learn from people's mistakes. And so you can obviously look at the US system, you can look at the European system, the Scandinavian systems and things like that. And really, adopt accordingly and learn from other people. Obviously, kind of what we started with at the beginning of this conversation, nothing will happen if you can't tackle your red tape issue, right? So that'll obviously roadblock any kind of innovation. But let's assume, but it sounds like you guys are making some sort of strides on that front. And, I think the interesting question is, what is the underlying philosophy behind free healthcare? Like, is it, and I'd have to imagine it's the, healthcare is a human right. Is that the underlying philosophy that Canada has?
Yeah, it is. The major underlying philosophy is that we need to be able to provide universal coverage to all the citizens, because healthcare is a human right at the end of the day, and everyone needs to have access to it, irrespective of who you are, what you make, and where you live. And that's a fundamental principle that we end up working with.
Yeah. I think the challenge with that is twofold. The first challenge is that that can become so broad. And so you have this kind of happening in the US, where you've got all these Medicare Advantage plans, and part of it is actually kind of the challenge about value-based care is that when you start trying to do value-based care, you start looking at, which is really positive, start looking at social determinants of health, contextual determinants of health. What are all these side things that are affecting the patient or the human? And you end up with this kind of race to the death that we're having from all these various plans of like all the various different perks that they can give patients to join their Medicare Advantage plan. And it's starting to get further and further and further away from healthcare. But at some point, it's like, when are you just babysitting the entire country and paying their mortgage and paying their grocery bill and paying for babysitting and just basically babysitting the entire country in the name of value-based care? So I think the first challenge is that it can become so broad that makes it really, at least for me, it makes it very, overwhelming to even think about when you start going down that rabbit hole. But I think that the other thing that's more interesting to me is when you have free healthcare, you talk about the government dealing differently and incentivizing the doctors differently, right? When I look at the US health system, the thing that I talk about like again and again and again is that in a way that's actually the problem, because what we've done is we've incentivized the value-based care. We've incentivized the docs, right? So we've said, okay, you're going to take a risk on this patient population. You're going to get, so what does that mean? That means that we've created this incentive structure and this dynamic where it's almost like it's my doctor's problem for me to be healthy. And it removes the responsibility from me onto my doctor. And so they're the one that gets dinged if I'm not healthy. They're the one that gets paid if I am healthy, right? In a good value-based care system. And I think that because we live in a society where we're just, we're used to immediate gratification. That's the way we live. I want to touch a button on my phone and the thing just shows up from Amazon the next day or a couple hours later, depending where you live. And that's basically what we expect from everything. We've kind of lost the ability to think long-term in a lot of different regards. And I think in our health as well. So when there's no responsibility on me to be healthy, then how does focusing on preventive care and trying to put some of the drivers that will definitely make a difference in lowering costs, how are those actually going to succeed? So I know that was kind of more of a monologue, but those are the two concerns that I see with just broad, free healthcare. What are your thoughts?
Yeah, you're touching on like a critical issue in why preventative care hasn't actually taken off, right? Because to shift the conversation around the incentive models and thinking about preventative care, the onus is truly on the patients themselves to get healthy. And we need to create an environment that encourages and empowers patients to take an active role in their healthcare. And this involves the necessary tools, education, and support, and how we end up thinking about how we're shifting how we view preventative care and taking care of ourselves as a country. And there are these type of public health campaigns to be able to do that. And I don't feel any country has done an amazing job. I do know there are some of the Scandinavian countries in Netherlands who has done a much better job in terms of education and awareness through, healthy literacy programs where they're educating patients about the importance of preventative care and how to maintain a healthy lifestyle. So nutrition, exercise, mental health, managing chronic conditions. There's a lot of public health campaigns and media campaigns and school programs that they'll also do a good job. And that could be enabled by, your digital health tools or your telehealth and your virtual support to be able to do that. But it's interesting, when we're talking about incentive structures and, putting the onus on patients. So could we have a model where we are paying, patients to take care of themselves a little bit better, right? So I'm thinking like a health rewards program where you're developing a program that rewards patients around the healthy behaviors and preventive care. So think about discounts on, insurance premiums or gym memberships or wellness related benefits that we've done in certain pockets. But could we actually take that to a completely, different level? Or when there's personalized health plans that are actually created maybe by a provider, a patient ends up getting rewards based on milestones that they end up achieving, or they may be getting rewards based on getting rid of smoking or, losing weight or maintaining healthy blood pressures or anything along those lines, right? Yeah. And I think that's where kind of these behavioral and financial incentives, or maybe we'll call them behavioral nudges in certain cases as well, can allow for that proactive, health management, because any early detection, anything that we prevent in chronic diseases, that's what's actually going to take. That's what it's going to take to truly change the dial on how we think about care in general. Because now a lot of the money we end up spending on is on those 5% of patients who end up having severe issues. And could we end up changing the way that we end up thinking about management of that kind of care as well? And ultimately, that's what's going to actually reduce healthcare costs, because now we're truly moving towards value-based and preventative care that focuses on, that holistic health and actually engages the patient in it. So I'm a huge proponent of it. As you can imagine, that raises a significant questions in terms of the roles. A lot of our traditional players play a role. Like, how does, if there's no patients coming into the hospitals or into the clinics because patients are taking care of themselves better, what's the role of the doctor now? Like, how does it change? How do they get paid? Do they get paid less? Do they get paid differently? Do we change the way that we think about their roles and responsibility, that they're stewards in terms of healthy prevention as opposed to treating the sick and providing treatments, right? And I think that this fundamentally changes the way that we end up thinking about it. And I think it's one where we notionally think it's the right way to go, but putting the structures and the incentive models and the payment, the payments and structures, I think is going to be the challenging part as well.
Yeah, I mean, you're describing an absolute best case scenario. Like, you're basically saying, what if we could shut down hospitals because there was no business, which would be obviously phenomenal. But that's where there's risk contracts and things like that can really come into play, where you want to align those incentives. I think that what we've seen in the U.S. is that we've gone straight to the risk-based contracts, and we're aligning incentives for the doctors, which is critical and important, because if the doctor's incentivized to just keep fixing broken things instead of preventing it from breaking, then you're obviously not going to see that transformation. But I think that you guys have the ability of using hindsight of looking at our systems and saying, how do we equally try to change the behavioral conversations of the patients? And I think that it would be really interesting, and I don't know if countries are doing this, but I think it would be really interesting to what's working for McDonald's, what's working for KFC, what's working for these fast food chains that keeps bringing people back. And I think that a large part of the answer is they focus on, they focus tremendously on the psychology of their customers. They focus on creating behavior changes for the worse, but creating behavior changes in their customers. They have entire, I've met some of these people. They have, I think we talked about this. They have entire departments that are literally science labs dedicated to figuring out the exact amount of crisp and crunch and addictive flavors to keep pulling people back and keep making them want more. I guess that's that's fine. I don't know if I'm going to say that should be banned, because we obviously live in a democracy. But at the same time, if we're going to try to counter that, then we need to be using a lot of those same techniques and bringing in psychology and bringing in persuasion and bringing in, people that understand the underlying behavior trends of people, and try to figure out, okay, how do we shift people away from that?
I actually love where you're going with this, right? Because you typically won't be thinking about how do you actually create analogies or similar models to entities like McDonald's and KFC. But I totally get where you're going with this, because ultimately where these companies truly excel, as you mentioned, is around psychology and customer retention and satisfaction, right? Which is why they keep coming back, which is one of the reasons where McDonald's or KFC or any of these type of entities create these loyalty programs and rewards and discounts and exclusive deals to encourage that repeat business. There's also these like consistent communications, and they do, great job with, user-friendly technology and enhancing, the customer experience just around it. And this is where, if you're applying those principles to, preventative care, instead of customer loyalty and retention, you're thinking about patient engagement and retention. So similar to loyalty programs, can you do health reward programs to incentivize them, create regular checkups and complete healthy screenings? And how do you actually gamify all of that so it becomes a lot of fun? And there's, the dopamine hits that you end up basically getting when you go to these type of entities. Could you create that same sort of gamification where patients can achieve, health milestones and receive badges and recognitions and rewards, and make it much more engaging and motivation, right? So this is where I do think there's an ability to get there, and I think there is a lot that we can learn from other industries, right? I think in healthcare, just looking at other healthcare players who are also behind is not going to be very helpful. And I think this is where we can learn a lot from different industries.
Yep. So in our, we could probably go on for 3 hours, but in our last couple minutes here, we kind of did this backwards where we jumped straight into the subject matter. But if I'm listening to this podcast and I don't know you, Shanil, I would think that you're so informed that I would think that you're just part of the health ministry there, the government. But like we mentioned at the beginning, you're a partner at Deloitte Canada. And so what is your work with Deloitte, and how does it intersect with the healthcare system?
Yeah, it's a great question, right? So, right now at Deloitte, I lead our national life sciences and healthcare business. And, for those who are not familiar with Deloitte, or maybe who are, the first thing they think about it is, we're an audit and tax firm, right? And,
okay.
And majority of the work that we end up doing, and we have, 400,000 people globally, we focus primarily on consulting. And what consulting basically means is that we work with a lot of different organizations to create complex strategies and try to figure some of these type of questions out in terms of how do you streamline operations? How do you actually think about shifting to value-based care? How do we bring in, cutting edge AI, digital and health solution that significantly enhance patient care? And a big part of our business is also what we call our human capital business, where we think about what the future of the workforce should be. So if we're actually shifting these type of models, what's the impact around doctors, nurses, and how do we adapt them to new skills and new capabilities that we need to get to? So that's how we end up working with organizations. And a big part of our consulting business is we are pretty proud to say that we are a purpose-driven type of endeavor where we look to make tangible difference in the lives of our citizens. And we do that by working with our clients who we can work with to help to strengthen our society and bolster our economy as well. And that's how we end up working with these different entities as well.
Love it. Well, Shanil, this has been absolutely fascinating. I really appreciate your time, and maybe you should consider a government role, because I think it's people like you, or thank God for Canada that at least you're involved in the conversation. But I think it's people like you that really, can make a difference there. So thank you so much, and I wish tremendous best of luck to you personally, as well as the Canadian health system.
Thank you so much. And, really love this conversation. As you mentioned, we can probably go on about this topic for another 3 hours. There's a lot of work to be done. And all I could say is the one thing, whether you're in private or public, or it doesn't matter what your role is in healthcare, resilience and being able to, adapt to changes is going to be a big part of it. Things can end up basically moving slow, but you need someone who is not someone, I should say people who can try to drive the change. And it's going to be an uphill battle in a lot of cases, but I'm pretty optimistic we'll get there.
Awesome. Love it. Thank you.
Great. Thanks so much.